What are the China bird flu symptoms? The first known case of new bird flu has been reported in China. The 41-year-old man who has been hospitalized with H1N3 strain of bird flu, health officials said on Tuesday. Bird flu has caused serious outbreaks in the past, namely in 2016-17 when 300 people were killed by the H7N9 strain. There are many different strains of bird flu present in China and some randomly infect people, usually those working with poultry. The risk of H1N3 type spreading is considered low, China's National Health Commission said. No other cases of human infection with H1N3 have previously been reported globally, the agency added. So what are the symptoms? Health officials did not give a detailed report of what the symptoms of the H1N3 strains are, but generally the symptoms of bird flu are a very high temperature or feeling hot or shivery, aching muscles, headaches, a cough. Early signs may also include diarrhea, sickness, stomach pain, chest pain, bleeding from nose and gums, conjunctivitis. The infection, which starts causing symptoms after 3 to 5 days, can lead to more serious health concerns. It's possible to develop pneumonia and acute respiratory distress syndrome, which can lead to death. Who is the patient? The man is a resident of the eastern city of Xinjiang in the eastern province of Jiangsu. He was hospitalized April 28 after developing fever and other symptoms before being diagnosed with H1N3 strain of bird flu on May 28. But he is now stable condition and preparing to be discharged from the hospital. It is unclear how exactly he became infected with H1N3, but health officials said it was the case of accidental cross-species transmission. Has it spread? None of the patient's close contacts have contracted the virus. It added that a low pathogenic virus, suggesting it is not very contagious. The risk of large-scale transmission is low, the commission said. This infection is an accidental cross-species transmission. How common is it? Philip Claes, a lab coordinator with Food and Agriculture Organization Emergency Center to Transboundary Animal Disease, said H1N3 is rare. There have been only around 160 isolates of the virus detected over the course of 40 years. Most of the cases have been in wild birds or water flow in Asia and some parts of North America, he said. So what is bird flu? Bird flu or avian flu is an infectious flu that spreads among birds but sometimes can affect humans. There are 4 strains that have caused concerns in recent years, which are H5N1 since 1997, H7N9 since 2013, H5N6 since 2014 and H5N8 since 2016. It manages to spill over into humans when they touch infected birds, their droppings or beddings, or kill and prepare the bird for cooking. You can't catch bird flu through eating fully cooked poultry or eggs, even in areas with an outbreak of bird flu. Is there bird flu in the UK? No humans have been infected with these in the UK, but there are occasional outbreaks in poultry and wild birds, including H5N8. There are 14 clusters of H5N8 in England during 2020 and 21, including Cheshire, where a temporary restriction zone was set up around a farm in March while thousands of turkeys were culled. Several other European countries have seen outbreaks of the virus in birds, with Germany having to kill 29,000 chickens in 2020 to halt the spread of H5N8. Markets where live birds are sold can also be a source of bird flu, which is why it has not been a problem in the UK so far. But there are measures you can take when going abroad, including to wash your hands regularly and especially before and after handling food. What outbreaks have been caused before? The worst outbreak caused by bird flu with the 5th epidemic of H7N9, which began in 2016 in China. The country had already dealt with several waves of strains since 2013. A total number of 759 infections and 218 deaths were reported by the World Health Organization and CDC. In total, around 1,200 people have been diagnosed with the strain of H7N9 since it first cropped up, and around 40% have died. The WHO has identified H7N9 an unusual dangerous virus for humans. Thank you.